Asif Choudhury MD built a medical career defined by responsibility, discipline, and care for others. Trained across multiple institutions and countries, he moved through medicine with a clear focus on service rather than status. His path reflected a traditional definition of professional success rooted in training, leadership, and technical mastery. Yet the arc of his life reveals a broader story about how purpose can evolve beyond professional titles. Asif Choudhury MD completed his medical education at the Institute of Postgraduate Medicine and Research in Dhaka, Bangladesh, before continuing his training in the United States. He pursued residency in internal medicine at Prince George's Hospital in Maryland and later conducted gastroenterology research at the Mayo Clinic in Rochester, Minnesota. His work there led to publications in respected clinical journals and helped shape his analytical approach to patient care. He later completed advanced fellowship training in gastroenterology at the State University of New York at Brooklyn and additional interventional training in Hamburg, Germany under Professor Suhendra. The combination of experiences along with a limited number of physicians who had been through advanced endoscopic training during a period of rapid technological advancement in gastroenterology serves to establish the individual in a very unique set of circumstances. However, his professional identity is not based only on his credentials. As an interventional gastroenterologist from 2000 to 2017, Dr. Choudhury's primary focus was on advanced GI therapeutic interventions, performing on a large volume of procedures within his health system. He became well respected for his expertise managing very complicated cases including esophageal perforation, stricture disease, and airways-related digestive trauma. He developed a significant practice in esophageal stenting and gastrostomy feeding tube placement for patients recovering from extreme traumatic injury or from the consequences of cancer therapy. In addition to being an outstanding clinical provider, Dr. Choudhury served as the section chief for the Division of Gastroenterology at Lee Memorial Health System located in Fort Myers, Florida. During his 6-year tenure as chief, he was responsible for both directing the department and providing direct patient care. For Dr. Choudhury, this leadership was more about consistency, accountability and mentoring others than it was about the visibility associated with holding a title. His colleagues viewed Dr. Choudhury as a provider who made reliable and rational decisions, and he provided support to staff members as well as patients when the circumstances were very stressful. Despite these accomplishments, Dr. Choudhury remained grounded in the belief that professional success was incomplete without direct community impact. Throughout his career, service outside formal medical settings remained central to his work. For more than 20 years, he treated uninsured patients on a weekly basis, often without compensation. He also helped patients obtain medications and follow-up care when financial limitations would otherwise prevent treatment. Every Friday, Dr. Choudhury sets up free medical consultations with his local mosque. This allowed him to provide people with accurate medical advice who did not have access to regular healthcare or any other means of finding accurate medical advice when faced with healthcare concerns. It demonstrated his firm belief that health-related information should be given away freely, in particular at times of distress and uncertainty. In addition to his free medical consultations, he participated in other community-based health awareness presentations and forums at cultural and religious events by providing information on prevention of disease, nutrition, and lifelong wellness. Through his being committed to others, Dr. Choudhury has developed an understanding of the true purpose and meaning of medicine. In other words, he believes that medicine is about supporting, helping and caring for the well-being of others, beyond simply meeting clinical responsibilities. As his career progressed, Dr. Choudhury's definition of success shifted. In reflections shared later in life, he described success less in terms of professional milestones and more through the well-being of his family. He has spoken openly about how his children's growth and future now represent his greatest measure of achievement. He views his role as a guide who helps his children pursue meaningful paths without being burdened by the past. In his words, personal success is tied to ensuring that his experiences create opportunity rather than limitation for the next generation. This perspective marks a departure from conventional measures of accomplishment that often dominate high-intensity professions. For Dr. Choudhury, fulfillment became rooted in peace, stability, and contribution rather than recognition. Faith and spirituality have played a steady role in shaping Dr. Choudhury's mindset. He describes prayer, meditation, and spiritual study as central practices that guide his thinking and behavior. These routines helped him manage stress during demanding years in medicine and remain centered during personal challenges. Reading faith-based teachings and engaging in reflective practices offered clarity during periods of uncertainty. He credits these habits with helping him maintain humility and perspective, especially in moments when professional responsibilities could overshadow personal well-being. His belief system emphasizes patience, service, and thoughtful decision-making rather than urgency or external validation. This grounding allowed him to navigate high-pressure environments while maintaining emotional balance and purpose. Like many physicians, Dr. Choudhury encountered moments that reshaped how he viewed his role in the world. One of the most significant influences came through his mother's illness and suffering. Witnessing her experience deepened his resolve to support others during their most vulnerable times. Dr. Choudhury chose to serve instead of running from challenges. Through this experience, he came to understand that while technical knowledge is valuable, so too are empathy and presence. His experience reinforced the importance of patience and reflection during difficult times. When people are uncertain about what will happen next, he suggests they focus on their health, keep close ties to trusted family and friends, and not give in to negativity, if at all possible. His continued advice is straightforward and realistic. Take care of your physical body, protect your mental health, and stay connected to individuals who are a reliable source of support. In 2017, Dr. Asif Choudhury stepped away from active medical practice. The decision did not represent a retreat from purpose but a transition toward broader forms of contribution. Outside of medicine, he has continued to engage with community organizations and professional networks, including the Bangladesh Association of South Florida, the Bangladesh Medical Association of North America, and the Mayo Clinic Alumni Network. He also maintains interests that reflect balance rather than productivity. Soccer, cricket, music, and cultural events provide space for connection and reflection. These activities allow him to remain engaged with others while sustaining a sense of personal well-being. For Dr. Choudhury, life beyond the white coat is not defined by absence from medicine but by presence in areas that foster long-term meaning. Dr. Choudhury's future goals continue to center on service. He has expressed interest in helping train medical graduates in Bangladesh, particularly in rural regions where access to healthcare remains limited. By sharing knowledge and experience, he hopes to support systems that empower local providers and improve patient outcomes. At the community level, he aspires to take on leadership roles that promote welfare and opportunity for future generations. His focus remains practical and grounded, emphasizing education, health, and stability rather than visibility. Travel and personal health also factor into his plans, reflecting a desire to remain active and engaged while maintaining balance. This forward-looking perspective underscores a life shaped by continuity rather than reinvention. Asif Choudhury MD is a model of continuous evolution and success. His career has included many facets of success including technical proficiencies, determining and developing leaders, serving as an example of service and commitment to others. Through working with many different groups and organizations that were not initially designed for success, all that led him throughout his journey to personal satisfaction and fulfillment. His reflections indicate that the pursuit of success goes beyond individual careers, and as long as you can maintain these connections, and serve, and mentor on a daily basis, your legacy will live on, through the work that you do, and those around you will see what you've accomplished. Dr. Choudhury's journey has shown that achievement is just one aspect of a life filled with meaning, and the ability to make and develop connections to the things that are truly important and valued in life can lead to long-term satisfaction and meaning.